Thank you very much, Barbara. Yeah, we're just going to move on now to Joyce. I think it was a great overview. Certainly learned a few things myself there, and can relate to that. You know, in quite a direct way with my own family as well. And I'm sure everybody knows somebody, or you know, can relate to this in some form or another very directly. I'm going to pass over to Joyce now, who's going to talk about the caring side. So I would maybe urge my remaining speakers if we could maybe try and get us back a little bit on time. We're running a little bit behind, and we are quite tight. So anything you can do to help me there, I'll buy you a beer later. Thank you very much.
I had to jump out. I'm absolutely loaded with a cold. I'm really sorry. I had to go and blow my nose. It's a challenge. I've got that, and a hanky. So I thought I'll go. Oh no, if I'm zipping through it, actually, I'll put my hanky down. I don't want to put it where anybody's going to be. I think, based on what Barbara was just talking about, it's easier to understand where we've been coming from round about innovation. And up until this point, everything we've been doing has been actually very low-tech. So the stuff I'm talking about is low-tech innovation. Everything we've done as well is about thinking, what Barbara was saying as well, is about people living well with their dementia. Also, just a bit about joy, you know, like thinking about the condition and doing things that can make, you know, a wee bit more aspirational to the stuff that we had before. That's one of our cups that we've done through our Dementia Circle project. Again, it's a really nice two-handled cup. It's easy for people to use, to pass. It looks quirky. It looks like something you would see in a kind of nice quirky shop, but it's actually really dementia friendly. So these are the sorts of innovations that we've been looking at. Also, because today it's around about nearly everything we've done in collaboration with other people that we would normally not have like gone to as sort of like kind of natural partners. Dementia Dog. That was one of the first collaborations that I worked on when I came into Alzheimer Scotland. And we did that. Now the two partners that are working on it is Alzheimer Scotland and Dogs for the Disabled. But we were a student project. It was a student project with Glasgow School of Art. Those were third-year product design students. We asked them if they would look at services for people with dementia from a different perspective. And one of the things they come up with, and that's the initial, that was their piece of work, and there's the Dementia Dog drawing at the bottom. That was their concept. So we've worked with those students over the last, now I think that's nearly 4 years now, and some of those original students are still partners with us in the project to do design. They do different bits with us, which is great because they've all graduated. They're all working in different fields now. We were really lucky. We got money from the Design Council in London for a Living Well with Dementia project. We were able to look at taking an assistance dog model further. There's assistance dogs. There's no IP for assistance dogs, but there'd be no model of people, you know, living with assistance dogs who had dementia. So that's Peter there, who's the chief executive, Dogs Disabled. They know about dogs. We knew a bit about dementia. So together we started pulling together some dog pilots. So we have there, that's the beautiful Oscar with Maureen. We had 4 dogs, 4 full assistance dogs living with people with dementia. We did a smaller pilot called Intervention Dogs, for the lack of a better name. So if people can come up with better names, it would always help. And Dementia Dog Days. So assistance dogs, as you know, that's dogs living full-time, doing a variety of different task-based work for people. Intervention Dog is about people living at home who are maybe not able to have a dog full-time, but still would really like to have that interaction with dogs. And that was like for maybe 2-3 hours with a kind of goal attached to that. And the dog days we have in Kilmarnock, where we have dogs who are sort of staff-turn dogs that can come, that are a bit robust, will do all sorts of things, and there's groups of people with dementia would come and they just act as a catalyst for other activities that we would have in that day. So here we had, in grey, we had the expected benefits. Those were, as you can see, anchoring, exercise, routine, reminders, social interactions. And when you're thinking about developments, those are things that are really key that help people with dementia. And then the yellow were the unexpected benefits. And I have to say the yellow actually came out just as strong, and in some cases stronger, than the expected benefits. And those were motivation, sense of self, a postponement of formal care, communication, relationships and emotional benefits for both the carer and the person with dementia were absolutely remarkable. So it has been a really successful pilot. We're just getting to the end of the pilot. That's just the blueprint. Because it was a service design project, we've got an absolute blueprint from start to finish in it. So if anybody ever wanted to see that or find out more about it, I can share that. That's Ken and Casper. And that, I have to say, has been a remarkable partnership. Those are Ken's words. Glenys and Ken would tell you that at the beginning of their journey, they were probably ready to look at residential, to look at other options for them. And Ken is now at home, living most of the day on his own now because Glenys is still working. She's managed to maintain going to work. It's just been a really successful partnership all round. And that is me. That's it's an iceberg dog. And that at the top, the assistance dog is the absolute tip of the iceberg. So these are the other things that, you know, as I say, we've been doing the dog days, the intervention dog days. So they've started to kind of pop their head up. But underneath there's all sorts of other things that we want to do round about care homes. We want to have a centre of excellence for animal interventions, looking at stress and distress, training and validation. And that's where we're hoping to get to in the next range of pilots. International influence and collaboration. I have to tell you, if you've got a dog, you can go anywhere. I've never been asked to do so many things internationally. Actually, I've never been asked anything internationally before. We had a dog attached to the project. We've got a partnership in Australia. There's 8 dogs being placed this month in Australia. So we are leading the way internationally in that. We're one of their key partners. And I've actually got a 7 o'clock meeting with them tomorrow morning because the time distance is a bit unfortunate. We've done stuff in Brazil, Spain, Canada. They're all going to be doing it. It's just going to happen. It'll just be like people are doing it at different times. So that's the Dementia Dog vision. Building on everything we're doing, having a centre of excellence, doing all these you know, kind of really creative things with dogs. Sorry, I'm zipping through it a bit, but if anybody wants to find out more, I'm happy to share any of it. The next sort of innovations that we were working on is a project we call Dementia Circle, and that was the cup, is one of the Dementia Circle ones. And what we talk about there is the pebble in your shoe. It's about the everyday problems for people with dementia that are just like irritants, but if that happens to you day after day, they start to become really significant. This is where we start to range into very light touch technology. This is just, it's off the internet, but it is a really good description of, as things start to become more complex for people, people start to find their own solutions. So taping things, you know, like volume up and down, on and off. That is just like what we would find if we're going to people's homes, that they've started to find their own solutions round about things. So what we did, and what we're still doing, is we go out, we work with people with dementia who have come to us with a significant problem, and we've looked at a range of solutions that we can just, you know, that are there, that are on the market, that can help them live well and live longer at home. Now, I think that when there's the projector clock that Tommy is working with, that gentleman, he was waking up his wife, I don't know, 10, 15 times a night to find out what time it was. He couldn't read the clock. Projector clock, it projects onto the wall so he can see it, it's big enough. His wife gets a full night's sleep. It's like, for us, that's an outcome. So we're looking about working with people about the experience. We have a website called Dementia Circle where we'll put what people have thought of products so people can go and see like things that we've tested, what people have said about them. Now that's in the process of just being updated just now, so the stuff that we've got on it, we've got another, I don't know, probably about 30, 40 products that are just waiting to go on it. The testing, we have pods in a resource centre, and I've got some pictures of those. We've started work on interiors, and we're now doing some training with our staff. Now these are all on the back of people like Barbara and others informing us about what people need, and then us taking innovations forward. So these are our pods. That's the one in Kilmarnock. So it's these everyday products, clocks, phones, clear containers, cups. These are things round about gardening, hobbies, things for eating and drinking. So we've got them there, so people coming into our resource centres can have a look, touch, feel, take them away if they want to try them, or we'll tell them where they can get them. Now, I'm just going to talk about this at the end, but we've now got some technology-enabled care funding, which has allowed us to now do tech pods, and we've got our first tech pod in Aberdeen, but we're hoping that we'll replicate the tech pods, or we will replicate the tech pods when we're, you know, like sort of, our partners have got time and we've got all the products in place. So, everyday and simple, they're all on the high street. Habitat clock. Now the Magimix toasters and John Lewis, a Habitat bin, it's a bin that looks like a bin, an IKEA box. You know, they're all just really simple products that people can see your toast getting made. It's a bin, it's got a handle, there's no fancy pedals that you've got to operate, but they all look good. You know, it's things that we would all have in our own homes. Well, I would have in my home. So then get in, as Barbara was saying, interiors can be really difficult for people, so we've started to look at our interiors. Just because it's dementia friendly doesn't mean to say it looks like, you know, I don't know how to say things tactfully. Institutional. So we've gone for a really contemporary look in our resource centres now. These are really good, like cafe tables. They're really solid. People can up and down off them, but they've got a central pillar so you can discreetly move those chairs for somebody using a wheelchair just to slip in really nicely. We've got choices, so we've got ones with handles, one not with handles, and they're black and yellow. They're a really good contrast against the white table. Tons of natural light, open shelving. So we've got like floating shelves for the cups and things, and then down below just open shelving so nobody needs to look or ask for what they're needing. That's what it's like every day in Kilmarnock. We have big buffet lunches. It's like lots of singing. It's great. But as you can see, it's like that. The high table now, things that haven't worked. The high chairs, nobody sits in the high chairs, but see that high bar? That's been the most successful thing that we've put into Kilmarnock, because everybody stands round it as if it's a bar. So if you've, you know, like been at a meeting and people are fed up, you know, they're wanting to move around, everybody will stand. It's great. It's a communal space. It works really well. And then we've got a more therapeutic zone through the back where we've got sofa stools, you know, like people can move that area around. Again, loads of great light, lots of good art, and lots of groups happening there. That's just another picture. That's our pod in Dumfries. And that's Dementia Circle. And just like adding to that, but I'll just, I'll go quite quickly, but that was just about the interiors and the thinking around about the interiors, just avoiding complicated patterns, sound and light, and a contrast to sensory mix, avoiding institutional approaches, and making accessible and understandable social settings, a sense of homeliness, but not home from home. Now, partnership again, we've worked with Graven. I don't know if people know Graven. They're an interior design company in Glasgow. They've helped us with our interiors. Again, not a natural partnership for us, but it's worked out really well. The last bit, technology-enabled care. This is new for me and newer for the organisation, but we have some technology-enabled care funding. Doreen has been absolutely inspirational in helping me get round all the other partners who have got tech funding and to us to understand what's out there and look at how we can make a difference for people, the same way we had with our low-tech stuff, but doing that more round about technology-enabled care. We have been working on a dementia-friendly technology charter, which is in the second draft, and we're hoping, well, we will have it ready for launch in December. We will. And the technology pods, we've got the first one in Aberdeen, but we're rolling those out. Attached to our Dementia Circle site, we're going to have a YouTube channel, which is going to have how-tos. You know, people being able to see technology, how it works, and see a range of products doing that. So if anybody wants to be filmed doing a how-to or doing things, we would do that. We're working with our link workers. We're hoping to get guidance put together that, as Barbara was saying, as early as we can in a journey of people with dementia, start to look at technology and the solutions that are there, and it becomes a familiar object. We've got a better chance of success. So link workers are the very people who are going to be seeing people at the very start of their illness. So we're hoping to build up their capacity to do that. And we're just about to start GPS trials. We're working with several local authorities who have tech funding. We're going to partner as well as us working with individuals to look at a range of different products to see, because as people progress through their illness, they will need a personalised approach to GPS, because there's different, not one size fits all for GPS, the same as everything else. Did I do that in enough time? And I didn't need to blow my nose, which was always a benefit.